All right, Melissa, thank you so much for joining us. We really appreciate you taking time.
Absolutely. I'm happy to be here. Thank you for inviting me.
Absolutely, absolutely. So I always like to start off with hearing kind of how you got into the behavioral health space, the ABA space.
Yeah. Yeah. I think, like many people in this field, I got here accidentally and went in initially on the school psychology track. And then, a classmate was telling me all about what she does and how she works with kids and how she plays all day. And it just sounded amazing. So kind of stumbled into it. And then, almost 20 years later, still in this space. And I'm fortunate that I've, worked with a company in the past who allowed me the opportunity to kind of be in all spaces. So I've been in the schools, I've been in the homes, in the community, built a clinic from the ground up, social skills groups. And then, of course, COVID threw me into telehealth. And I've really done it all in this space. And my latest venture has led me into the technology space with an ABA, which is so fun and different. And so yeah, that's where I'm at now.
That's awesome. That's awesome. So because of your lengthy experience in a lot of different roles, right? You've worked closely with families, with independent clinicians, with startups. Where do you find the biggest disconnect is between how systems are built and how care is actually delivered?
Yeah, I would say that care happens in the real world. And sometimes, with the best intentions, these technology platforms are created where I think it can be hard to utilize them functionally, right? So I'll give you an
Mm,
example. I work closely with a nonprofit where I am working in shelters, helping and supporting families literally coming in off the street and living in their cars. And these conversations and assessments are tricky and they're delicate. And if I am in my computer typing,
mm,
right?
mm.
Or writing things down and I'm not fully engaged in those conversations,
Yeah.
that's not great. That's tough. And so I think sometimes technology can be helpful. We really need BCBAs need the technology to support us in these real life situations. If it's not just me using it in a meeting or me using it after the session, it is me using it during these sessions as well. Can I use it in the school? Can I use it in the classroom? Can I use it directly during a session or indirectly? Does it
Absolutely.
cover all of those environments that I spoke to previously? And if that's a yes, then I think that tech platform succeeded.
Absolutely, absolutely. I remember hearing a story one time about a group that was doing a technology for a hospital system, and they spent, I don't know, hundreds of thousands of dollars researching how to make the system better and blah 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 blah. And then they brought in a consultant, and he had one conversation with the nurse, and he said, "Make the buttons bigger." On the UI, make the buttons bigger because she's looking, she's talking, she's doing things. Her gloves are on.
Yeah.
The buttons are too small, make them bigger, and that was like 80% of the improvement that happened. Simple things that make it actually practically valuable.
Yes, absolutely. Yeah, I actually just partnered with the VB Map team
Mm,
giving feedback on
mhm.
their app that they created, and it's such a wonderful platform, and some of the recommendations were very simple things like that where, okay, I am doing this direct assessment with this client, but there's things going on.
I'm getting too many notifications, I can't pay attention
Right.
to the 8 things on the
Yeah.
screen. Yeah.
And, how can we simplify it? How can we just make the workflows make sense for us that are
Mhm.
actually, in it doing
Yeah.
doing those assessments? And so, yeah, it's a great team and I love how tech platforms are reaching out to BCBAs to do
Mhm.
that testing because I
Absolutely.
do think that that is something that wasn't happening before, and now
Mhm.
companies are really leaning into it. Like, let's go to these BCBAs. They are the subject matter experts here. Let's get their input on these things. And
Yeah,
so
let's
that's
actually
been
ask
really
them
nice
what
to
they
see.
need. Yeah.
Yeah.
That's awesome, that's awesome. So, you do spend a lot of time in the ABA technology space. Um, what is one thing that practice owners or practice leaders should be really cautious about right now? And then what's one thing that's really worth spending time and worth, investing and leaning into right now?
Yeah, I would say that anything that increases documentation burden, right? I don't
Mm,
want technology for the sake of technology. I was recently using a platform where, it was a lot of repeated information that was required of me. I was copy and pasting a lot of information into, these certain sections within the platform, and it was just wasting my time,
Mhm.
honestly. So I would say be weary of technology just for the sake of, having some sort of platform out there. I would say that I love how platforms are starting to really lean into supporting caregivers within their tech,
Mhm.
right? So caregiver apps, the caregiver mediated model is definitely here to stay, and I love it. And that is a big portion of my work also, is direct BCBA led sessions with families and going directly to the family themselves. So I think any sort of platform that can help support data collection on their end can support, transcribing parent sessions between the BCBA and families, right? I currently met with Intraverbal AI and was really fascinated to see their transcribe tool. And how nice would that be, right? To not have to, again, be there typing everything out. You have something that's much more accurate. I do parent meetings all the time. And for me to go back and say, I'm pretty sure we talked about this. I think we did. I'm pretty sure I
Mhm.
made this recommendation
Yeah,
before. But for me to be able to capture everything that I say and do and practice during our sessions, it's pretty impossible, right? So to have
absolutely.
this data that is there in the background supporting me and transcribing all of the recommendations that I make, it's very, very cool to see.
Absolutely, absolutely. Yeah, I heard about a technology recently, and I don't remember the name of the company, um, but they were specifically focused on caregiver support, and it was an app that would plug into your phone that would just stay active passively, taking notes. And but one of the really cool things it did is it said that they walked through is that it monitors tonality of the patient to monitor vocal cues to give you in the moment readings of likely stress, likely pain, etc., based on the topic, right? They're talking about pain and he talked like this, but there's a 10 microsecond longer delay between the answer from this one to this one.
Yeah.
We think the pain is actually higher. Really, it was really a very, very clever use of AI, and
Interesting.
that it can spend hours to think about, like what would take a person minutes to think about and write out is like half a second. There you go. It's very, very cool. It's very, very cool. So we are a marketing and advertising company in the ABA space. So I always have to ask this question: what are you doing right now that gains you your best clients, your best partners, especially outside of word of mouth? Because of course that's always the best business generator. Hopefully.
I would say that long gone are the days of doing it all. And that
Mm,
specialization is here, and it's here to
well said.
stay, and I love how our field is moving into that.
Hmm.
I had mentioned before how I had, experience across all settings, but, I think we all thrive in different environments, and we all thrive with maybe some of us do better with the littles, and some of us do better with teens or adults, and some do better and love the school environment. Some, love being out in the community, and so really if you find your niche, right, I think that is important first and foremost, and then building from there, right? What do you want to do? What makes you happy in this field? What parts of your job do you love? And then leaning into that. And, I think when you're talking about building your organization or scaling, slow and ethical for me is the way to go. And if you really just think of your IEP team, right? Who is sitting in that meeting? The OTs, the PTs, the school psychologists, right? Start with those that you know. Start with relationships that are already there. These people, they know you. They know how you work. They know how ethical you are and how much support you give families. And so really starting there, I think being having this relationship driven model first and foremost, I think is huge.
Absolutely, absolutely. And then what's one marketing tactic that you're either currently considering or just watching really carefully in the marketplace, or either for yourself or for your clients?
I do have to say a red flag is
Yeah.
capitalizing on staff who are burned out. I
Um,
think that there's a lot right now in our space where it's like, "Burned out? Come here. You're burned out? Do this." Right? I don't know, I'm not a fan of that part of it. I think it's very natural that we all get to that place where it's tough and this job can be really tough. But I would say the educational authority in marketing, I think is great. And I love that. I love leaning into that where we have these companies now that are contracting with BCBAs to host events, to put on CEUs for their companies, to podcasts, Substacks, right? Support staff. Let's not label the burnout. Let's support you and
Yeah.
right different ways and give you tactics and tools. But then also these companies are sponsoring, supporting those BCBAs. So
Mhm.
I really love that, using BCBAs at the top of your marketing funnel, so to speak. And
Yeah.
I think more companies can do that. And there are quite a few that do that. And, I think also if the company is on mission,
Mhm.
that's huge, right? What is the mission of those that you wanna partner with and consult with? And, there are a few in the space that hold mission above all. I would say, Frontera is one of those, Therapprove is one of those.
Yeah.
You have these CEOs who are really about supporting first and foremost the family, and let's get back to the basic there. And so making sure that if you can stay aligned with those you partner with. So if they're on mission, great,
Uh-huh.
green flag.
Absolutely, absolutely. That makes perfect sense. And putting your money where your mouth is, so to speak, right? If you actually care about the people that are burned out, then offer them actual support, not just change your job, come over here.
Yeah, exactly.
Mm. That's awesome. That's awesome. Well, thank you so much. I really appreciate you taking time, and I appreciate the work that you're doing in so many different client organizations.
Absolutely. Thank you.
Absolutely.